Proton pump inhibitors or acid-blocking medications can be extremely helpful and even life-saving, but I often see that many people are prescribed these medications for years and sometimes decades without ever being properly reevaluated to determine if that medication is still appropriate. So today, I want to talk about what we actually know about the long-term use of these medications, who should not stop them, and who may be able to safely wean and discontinue these medications. Now, before we dive in, I want to be clear that this video is for educational purposes only, and any decision about starting or stopping a medication should be made in partnership with your personal healthcare provider. So let's dive in. First, let's be absolutely clear that PPIs have a role in certain conditions. These include severe erosive esophagitis, Barrett's esophagus, gastric or duodenal ulcers, active gastrointestinal bleeding, and certain post-surgical or ICU settings. So this conversation is not about demonizing these medications, but it's about using the right medication for the right duration and individualizing the treatment approach so that it's right for you. Most guidelines suggest treating with PPIs for a limited duration, maybe 4 to 8 weeks. But in reality, most patients stay on these for months or years. If these medications are continued long-term without a clear indication, that's where the real risk lies. So what are the potential long-term risks of chronic PPI use? Infection. By lowering the stomach's acidic content, this can impair your body's natural defenses against infection. Examples of infection associated with PPI use may include acute gastroenteritis, C. diff infection, community-acquired pneumonia, and higher risk of viral infections. Stomach acid actually plays a critical role in certain nutrients being absorbed effectively. So if you're on a chronic PPI, it's important to think about nutrient deficiencies and maybe even testing your levels of B12, iron, or magnesium during your next physical. We see reduced beneficial bacteria, increased potentially pathogenic bacteria, and a possible connection to SIBO, or small intestinal bacterial overgrowth. Long-term use of PPIs has been associated with a dose-dependent increase in chronic kidney disease, increased diabetes risk, and increased fracture risk, especially in children and older adults. Now, you may have heard concerns about PPI use in dementia, and earlier studies did raise concern. There was a recent large meta-analysis that did not show a strong association between PPI use and dementia, but because dementia can be associated with things like nutrient depletion, thinking again about B12, iron, magnesium, or other nutrients is especially important if you're on a long-term PPI. Not everyone is a candidate for stopping or discontinuing their PPI. Patients with Barrett's esophagus, severe erosive disease, gastric or duodenal ulcers. In these cases, the benefits of PPI outweigh the risks, and you should continue to work with your healthcare provider to make sure that it's the right treatment for you. Now, very importantly, if after working with your practitioner, you've decided that weaning and possibly discontinuing PPIs is best, this needs to be done very methodically because stopping PPIs cold turkey will backfire. Your body becomes used to the acid-blocking medication, and if you stop this abruptly, it's going to lead to rebound hypersecretion of acid, and symptoms often worsen, at least temporarily. This inadvertently leaves patients thinking, I must need the acid-blocking medication forever. So deprescribing has to be a gradual approach. When deprescribing may be appropriate is for those patients with no clear ongoing indication, symptoms are now stable or resolved, the underlying drivers have been addressed, and the patient has appropriate support and understanding as to how to properly deprescribe these medications. When done correctly, this can lead to outstanding results. So in practice, clinicians typically use one of two approaches: either a step-down approach or tapering. Tapering refers to the gradual reduction in the dosage of the medication you're already on. This may take several weeks, and it's important to go slowly and allow your body time to adjust. The other approach involves switching to a lower strength antacid and gradually reducing the dose as well. Now, it's critical to address all the other drivers such as stress, motility issues, digestion, and absorption. We have to support underlying physiology while tapering these medications. So if you've been on a PPI for a long time, it doesn't mean that you or your practitioner has done anything wrong. It simply means that it may be time to reassess and determine if that medication is still indicated for you. So in the following videos, we're going to break down how to address GERD from a functional medicine perspective and what specific things you can do to restore proper functioning. If you found this series helpful so far, please consider liking and subscribing. It really helps this new channel grow. I'm Dr. Kate. Thanks for being here.